So yeah, I've ruptured my Achilles. It's a horrible injury. So, you know, if it's happened to yourself, you know, I'm sorry that it's had to happen, but look, you'll pull through, you'll be all right. It's gonna take time to get better, but it will eventually get better. I'm gonna get straight into it and just say how my injury occurred. So I've not played football for about 6 years. And about 2 weeks ago, my friends sent me a message and they said, do you want to come and play 7-a-side? Whenever I get that sort of text, it's like, it's hard for me to say no. But what I said is I'll come and I'll play in goal. So I won't play out on pitch, I'll just take it easy, play in goal. And I did. Went in goal for about 45 minutes. I think the last 15, 20 minutes, I was a bit comfortable when I came out on pitch. I scored a few goals and I thought, I'm back, you know, this is great. Not had this feeling for ages. So I was happy, felt good. 2 weeks later, I get another text, hey, do you want to come and play football? And in the back of my head, I knew I should have said no. But again, I couldn't really resist. I said yes, I'll just go in goal. That'll be fine, you know, same as last time. So I went in goal, and whenever you get told, yeah, you know, you go and play 7-a-side, you play in goal, you always just, oh, it won't hurt if I come out pitch for 5 or 10 minutes, you know? So I came out on pitch, not for long, and I was taking it easy, you know, I wasn't doing anything like highly competitive as such. I wasn't taking it that serious. And all I'd done was turn around. I guess it wasn't even really a sharp change of direction. It was just turned around and bang, I heard a right loud crack. As soon as I heard this bang, I thought someone kicked me in the back of my boot, because that was the sort of noise that it made. So I've turned around to see who kicked me, and as I've turned around, nobody's there. At which stage I knew straight away that's my Achilles gone. And it's happened to me before, so this is the second time that this injury has happened to me. First it happened on my right foot, now it's happened on my left. So as soon as I saw that no one was there, I knew exactly what situation I was in. I was a little bit emotional at the time, in terms of angry and disappointed, just because I knew the implications that this is going to have for the next 3 to 4 months. And sometimes, you know, these things can slow you down as to where you think that you're supposed to be going in life. So yeah, I was a little bit angry, upset. Obviously I couldn't do anything, I'm stuck on the floor. So yeah, then the adrenaline calmed down and I calmed down myself, and I said, look, you know, we need to arrange for someone to get me a lift to the hospital, because when you rupture your Achilles, I mean, if it's a full rupture, I was almost certain there was a full rupture, not a partial at the time, but there's no point trying to walk on the foot. I mean, the first time I had absolutely no chance I could even put any weight on there at all. And if I did, I mean, it feels like your leg's like flopping off. Your foot, sorry. It feels like your foot's flopping off and it's got nothing attaching it. But if you're trying to walk about still, you're potentially just going to do more harm than good. I know, like, the best thing to do, if you can, is just get someone, couple, you need 2 people, lean on them and hop. And if you can't, get someone to carry you out. Do not try and walk on it, because you might do more harm than good. If you can even stand on it, it might be a partial tear, not a full rupture. By you walking on it more, you might turn it into a full rupture. So yeah, that would be my first advice. Get someone to carry you to a car, and you need to go to hospital or A&E as soon as you can. Which is what I done.
Man's gone to hospital, learning how to use this wheelchair thing. It's calm though. I have to start playing basketball in this thing, isn't it? What you saying? But yeah, fuck it. See what the hospital say. I know it's bust. 2018, I bust this Achilles. Now 2024, I've ruptured this one. Come show them the Achilles. Come show them the thing. Look, see that gap? Bust open, man. Fucked. Ooh, it's about an inch. Man. Peak.
And when I went to the hospital, you have to wait for a few hours, etc. But they wanted to put my foot in a cast for 4 weeks, and then they wanted to give me a boot. Now, the first time that I ever got my Achilles ruptured, the process was completely different, and they just gave me a boot and for 3 months, and it naturally healed by itself with no surgical treatment. And I was happy with that route as such, because I've had surgery before, and it's not nice when you have to have surgery, just because you're getting put to sleep, you're getting cut open, there's a risk of infection, and it's just, obviously you're asleep so you can't feel anything at the time, but it's not a nice process. So I mean, I'm not a professional athlete as such, so I'm not in an immediate rush to get back to optimum level, so they decided on me it would be best to take the non-surgical route, even though I've had this opinion from professionals now in the hospital. It was just a coincidence that I ended up going to about 3 or 4 different hospitals in 2 days, and I got multiple different opinions from multiple different people within these hospitals. That was good, because I could see what was the best option for me, and in the end the best option that we went for was put my foot in a cast for 2 weeks, and it's set at plantarflexion, so it's set like this, and then they'll put my foot in a boot for 3 months, 12 weeks. So, and what I was told was there's not too much difference in that outcome whether you do surgical or whether you do non-surgical, okay? But the difference that they can find is, with the surgical route, you are at risk to infection, which I don't like.
Brother, it's like 4 a.m. I've got the boot on now. Obviously, I've ruptured my Achilles, and I'm not too sure how bad it is, but it's bad enough. But to be honest, I'm alright. Just crack on, innit? What else am I gonna do? Just crack on, man. Crack on. Some people in there in some bad situations, so I'm thankful for the situation I'm in. You know what I'm saying?
A common question that I get asked is, how's the pain? So at the beginning, my pain threshold was very high. I guess the adrenaline was still high, so yeah, I couldn't really feel that much pain at the time. It is extremely painful, but it's a weird pain. But that night and the night after, the first 2-3 nights, the pain is unbearable. It's so bad, I couldn't even sleep for the first 2 nights, because you can't even get comfortable. You've got something on your foot that you're not used to. It's so heavy, especially when it's warm weather. You don't know how to put your foot, what position to put your foot in. The swelling starts coming out into the Achilles. So as the swelling's coming out over the first 2 weeks, that is extremely painful. I found it extremely painful, and I just tried to stay lying down with my foot elevated as much as I can for the first week, because I want to get the swelling down as much as I can. And speaking from experience of my first injury, what I can tell you is, to get that swelling down is almost vital, as well as in the later stages, you want to get the scar tissue down as much as you can. And I'll talk to you about that in detail further down the line. But at the moment, we're in week 1. I've still got the cast on my foot right now. What I'm actually going to do is I'm going to show you how the cast was put on from the doctors, and some of the advice that they gave me at the time. So you can see that.
Oh, that's better. Just let your muscles relax.
Fine.
There we go.
Think something else.
What we're trying to do is shorten the gap.
Yeah.
Okay. A little bit higher. There we go.
There's a big one in the middle.
Yep. No, just go all the way down. There you go. You can always go from side.
This one should just go from here.
Go over the top. That's it.
Right.
Okay. Then use that bit at the back.
You'll be fine a little bit, very quickly.
Okay. Had you just taken football back up?
Yeah.
Yeah.
But it's the second time I've done it, so
Right. On the same leg.
no, I done it on the other leg last time.
Right, so we do things differently now. Okay,
Yeah,
before
really.
it would be serial casting. Now we don't do that. So you're in a plaster for 2 weeks, and then you go into a big boot. That's different to the boot you came in.
Okay.
Okay, it's been specially designed for Achilles injuries, but it is a lot heavier than a plaster, and a little bit heavier than that boot that you were wearing.
Okay.
We don't put air in anymore, we take air out. And it's got a beanbag insert.
Is this enough or do we need to
Yeah,
use?
no, that's fine. Because you've got the extra padding over the toes. Okay.
I think should we get another roll ready in case?
No,
It should be enough.
yeah, no, it's fine. So, you're not allergic to any man-made products, are you?
Nah, nothing.
Okay, so this is what we call polyester.
Yeah.
Just relax a little bit more for me now. There we go. So this is a man-made material that's very rigid, okay? But it has got some give in it because we want you to be able to move your toes and keep that calf muscle moving inside.
Okay. So because I've had that other boot on for 4 days, I'm essentially behind in program now, am I?
No,
So can I have this on for less than 2 weeks then?
no. No. There's a reason why it's for 2 weeks.
Oh, we should just
Don't worry
cut it
about
off.
it.
Don't leave it.
Put it underneath. Turn the toes back. No, if we were to put you in the boot a bit earlier,
Yeah. It wouldn't work as.
it wouldn't work as
Intended.
effectively now. So there's reasons for the 2 weeks.
Yeah, yeah,
Okay, in the plaster.
Start from the bottom.
Start from the toes, yeah, and go up. Okay, right, go for it. No, but it was a good try though, wasn't it? Trying to get out of the plaster a bit earlier.
You know, I went to 3 different hospitals and I still got the
You
boot.
did?
Yeah.
Wow.
Who gave you the boot?
Well-
No, they shouldn't have done.
Yeah, they discharged me and said, you know, we're not liable if anything happens.
Yeah, well, there is that as well. But, you know, what another hospital does is different.
Yeah.
Okay,
Thank you.
just pull down on that toe a little bit. You're welcome. That should be a bit more comfortable though once it settles.
More comfortable than the boot.
Okay.
Oh.
Yeah, because did they put any wedges in the boot?
Yeah.
Those wedges don't actually quite give you the right angle, which is why we've got a different sort of boot that's been designed for the Achilles.
Yeah.
But at this stage you want to rest the Achilles and shorten the gap. So that's why we want 2 weeks, so it starts to shorten the gap, and then when you go into the boot, it's set at the right angle,
Okay.
and then the physios do all the rest.
Okay.
Okay?
Okay, thank you.
I'll see you in 2 weeks.
Alright, bye.
So the plaster will be drying a few minutes, then you should be able to leave from here. Do you need to collect the medicine from the pharmacy, blood thinners, injections and something?
Yeah.
Okay. And this plaster, it need to be dry, you can't make it wet.
Yeah.
If in case you like put in a bath or anything, like it happens accident, please give us a call, we need to change it then,
Okay.
but try to be safe please.
Okay.
And you can't put anything to scratch in it,
Yeah.
and you need to keep your leg elevated all the time. Keep it up like above your nose level, otherwise it'll be swell a lot, so you
Yeah.
don't want to have swelling in it. It's very tight, there's no place to go like swelling to be on it,
Yeah.
so keep it elevated all the time. I know it's not nice in this heat,
Yeah.
it's going to be very hot.
Yeah.
But if any issue like pins or needle or like severe pain, I'll give our numbers to give us a call, yeah?
Okay.
One more minute. Yeah, done. How it feels? Better?
It's okay actually.
Good.
But now,
No,
I don't want to speak too soon.
no. So you're not allowed to put weight on this one, alright?
Yeah.
So just keep it in momentary. There we go, all settled. Just be careful, don't put your weight on anything against it.
Okay.
How have I been surviving for the last week? Okay, so first week, you're not immobile because you can get about on crutches, or if you've got a wheelchair, then you can get about on a wheelchair. It will be painful, and I'd advise to do minimal action, because the more you're standing up, even if you're on crutches, that blood flow is all dropping down towards there, and it's just going to create more swelling, and it will be more painful. So you want to lie down or sit up with your foot elevated as much as you can. And when I say elevated, I mean like at least at heart level. Okay, this will help to reduce the swelling. On the first, like when it instantly happened, I did apply ice on like my calf and my Achilles area. But once they put a boot or a cast on, you can't apply the ice. So then it's just about elevation as such. Something that I have been doing is taking as much anti-inflammatory things as I can. So my diet has been targeted towards anti-inflammatory products. Simple ones like turmeric, ginger, apples. I've been taking a lot of like green tea, ginger tea, been having peanuts, spinach. But yeah, have a look at what anti-inflammatory natural products you can take to try and reduce the inflammation. I've been taking some vitamins that are good for joint pain, etc. I typically don't take vitamins, I'll be honest, but I've give these ones a try. It's actually here. What is it? It's Solar 7 joint support. These are the ones that I've been taking. I'll be honest, I couldn't tell you if they're doing the job or not, because I'm not actually putting my body through any real strain. If I was going to the gym on like a daily basis, like I usually do, then I could tell you, because I usually sometimes get joint pain, but I'm not doing anything, so I couldn't tell you if they're working or not, I'll be honest. One thing I want to clarify is, look, I am not a doctor. I'm not a medical scientist. I'm just talking on previous experience I've had with my previous right Achilles and current experience I have with my ruptured left Achilles. When you have the boot on, it's very difficult to have a wash. Now, the first 2 days, I'll put it out there straight away, I didn't even have a bath or a shower, and my name's Fresh 100, and the reason I done that is risk to reward. If you're by yourself and you go in the shower and you're standing on one leg, because you can't stand on two legs because one of the legs has a cast on, and you slip over, which is a high chance, what are you going to do? It was just too dangerous for me to even risk. So risk to reward, it wasn't worth it for myself. I waited 2 days till I got a bit more comfortable, and then what I did do is I put a black bag around my cast, tied it, ran a shallow bath, climbed into the bath, because that's easy. You can climb into the bath pretty easily, take your time while you're sitting down, as opposed to slipping and sliding all over the place. Slowly lower yourself into the bath while your other leg is still hanging out. Have a quick wash, and then it's pretty simple to get out. You have to be very careful to make sure that you don't get your boot wet or damp at all, and you don't even want to build up condensation in there. You can change the size of the cast, so you've got to be very careful when you have that boot on, when you're taking a bath or shower. But yeah, you can do it. The first 2 days, 2-3 days are the worst in terms of pain. The first whole week it is very painful, but the pain eases up in the daytime, and then it becomes where it's only painful as you get up to go to the bathroom, because every time you get up, then all the blood starts rushing down into your Achilles, and you can really feel the blood like in the area around your leg, and it hurts, it's painful. But yeah, apart from that, you only really feel the pain when you're actually getting up to try and do something. What I will say is, if you've been impacted and you've got a Achilles injury, or any injury, send me a message in my comments. You can DM me on any of my other socials. My name is KeepingFresh100 on Instagram and on TikTok. You can send me a message, I'll reply. Some people ask me, how do you keep up spirited when when you have such a serious injury? Now, for myself, fortunately, it's not had too much impact on my life, in terms of, yes, I'm in pain, and yes, I can't really get about as much as I would like to, but it's not had an impact in my day-to-day lifestyle, in terms of I'm very healthy still. I'm not sick, I'm just in pain. Something that I'm aware of is, let me give you an example. Let's say I was a plumber and I relied on my physical well-being to do my work. If I got this injury, it would then have huge financial impact in my life if I did not have insurance, or if I did not have people that worked for me. So it is beneficial for some people to take out insurance in case something like this happens, which will then cover you for your bills, etc. So that's something that, you know, depending on your line of work, you may want to look into. You might sit there and think, you know, well, I don't play sport, so all I do is work, physical job, so nothing's going to happen to me. But I mean, if you work in a physical job, then that means something can happen to you, because you know, something could drop on your toe, or anything could happen, right? I don't want to say no crazy things, but something can happen. So just think about it. So yeah, what I'm going to do is every week I'm going to give you guys an update on how my Achilles is, how it feels, what advice I've been given, and further down the line we'll see what physio I can do. I'll record everything so that you can see, and you can see whether your experience is different to mine, or if mine's slightly different to yours, whether my results worked or not. And yeah, hopefully it will give you some insight as to where you should be at each stage. I'm going to do every single exercise that they ask of me and more. I'm going to do, yeah, everything they ask of me I'm going to do. So I'm going to try and come back as quickly as possible. So we'll see whether the treatment works or not. And yeah, you can get a good insight. Make sure you hit that like button. Make sure you subscribe if you haven't already. You're going to see plenty more of this content coming. And if you have any questions, just drop them in the comments and I'll be happy to answer them. Or if I can't, I'm sure someone else in the comments will answer them for you. All right, peace.